course is on health promotion and prevention. What are your thoughts on prevention and health promotion as far as our roles or responsibilities as physical therapists?
Did you see this?
I haven't read that yet. I've been so busy.
No, it literally just came in the mail today. And that's why I was like, oh my God, how timely is that? So this article, I don't even remember what the question was, but I'll come back to that. But I do think, yeah, I'm an APT. I think do all APT members get PT in motion? I think
Yes,
so.
I think
But
so.
anyway, so like, this is a pretty decent article to start. And what's funny is the very first paragraph is written by an attorney in Pittsburgh, Paul Welk. He's not my attorney, but it's just funny that we were having this meeting today. But anyways, I strongly recommend that everybody take a look at this. But as far as like the wellness and what was the question?
What do you think what are your thoughts on our role and responsibility as physical therapists in promoting health and wellness in our bodies?
Okay, so I thought about this question ahead of time, and I drew out a little thing here. So I don't know, can you see that?
Yeah, I can.
Okay, so I'm just going to go through this really quick.
Sure.
First of all, I think that we have a really significant role in health promotion and prevention, and I think sometimes that the name of our profession, physical therapy, is kind of a misnomer, or rehab, physical therapy and rehab. It's kind of a misnomer because our profession has really evolved into a lot more than that. And I think that in moving more towards preventive medicine and preventive healthcare, we need to evolve with that. And unfortunately, in my experience, I just haven't seen that model be taken to as strongly in a lot of like outpatient private practices. The cancer center, I think, did a great job of it with like prehab programs. That's where I learned a lot of stuff about prehab and incorporated it more into orthopedics, like orthopedic prehab. And in the Army, it was actually very good too, because we have this whole physical training and readiness program, and we try to prevent injury as much as possible. It's better than it used to be, but not perfect. But anyways, here's what I think about where we should be. So we're kind of, the patient or the individual is in the middle, and this is like the healthy person, right? Mm-hmm. And so the PT and the athletic trainer and fitness professionals and coaches and stuff are kind of all working together on promoting the physical health and fitness of the individual. And then what did I have over here? Like psych and behavioral, behavioral health are there to help to improve improve mental well-being and emotional health, sustainability, mental performance, resiliency, those types of things. You have your physician that's looking out for any medical concerns or chronic issues. And then I also have on here a dietitian and social support. So like, I think all of those factors need to work together in order for a person to truly be well. And one of the main reasons why I did not want to stay in insurance-based healthcare and or like a PT model that we are kind of used to and comfortable with is because I never found that I had the time or the opportunity to blend all of those things together and bring them all together for my patient. I was just, even in most places, because of insurance, and because of scripts and whatever, you have to focus on like, we're focusing on the shoulder because that's what you have a referral for. Mm-hmm. We have to get another referral for the neck. I actually like don't even understand that stuff. I don't even get it, because I started out my career in the Army. We didn't practice like that. I still don't get it. So, so I really feel like physical therapy needs to evolve into addressing the individual comprehensively. And whenever, I think I actually wrote some stuff down. So we do our best to set, I'm just going to read this because I think
Sure.
it's better than me trying to speak it. We do our best to support optimal physical function throughout the lifespan. This means optimizing exercise and activity, but it also means we educate our clients or our patients in the roles of what other healthcare professionals do and how they can assist. We also educate the individual's support system. So a lot of people take that for granted and they don't think about how we can educate the individual in improving their relationships with others so that they can have that support around them at all times. So like I can give you one example.
Okay.
I've been really trying to clean up my diet lately because it makes me feel better to eat more vegetables and blah blah blah. Like everybody should eat more vegetables, right? But my husband and my two kids don't like vegetables. Like my kids like vegetables more than my husband does. But when you have that kind of environment surrounding you where your goals don't necessarily mesh, and that's just one like silly example. It's not that big of a deal. I still eat my vegetables. But when you have that kind of environment around you, you don't it doesn't make things as easy. So I think just drawing attention to that is a very integral part of comprehensive wellness. Even if it's just mentioning it, like one line, like, "What's your family life like? Are you married? Do you have good relationships?" Like those things are okay for us to talk about. And I think it's important because somebody can't really focus on motivating themselves without the support of others. So I think it's
I
our
like
role.
that.
I do.
I like that point because it also brings up that not only do you have to be out in the community advocating for health, but even in your job, even in the clinic or the hospital, by working with the patient support members, you are improving the health of the community, not just the health of the patient for their compliance and with the exercise program that you're prescribing, but also for the family to be healthier, which translates and moves out from there.
Absolutely.
Great point.
You can't do anything alone. It takes a village. It takes a village. I found that out when I had kids.
As many of us do.
Oh my gosh.